You're now listening to Protecting Your Nest with board-certified family medicine and obesity medicine specialist Dr. Tony Hampton. For more, visit drtonyhampton.com. Welcome to the Protecting Your Nest podcast, where we are all on the mission to achieve metabolic health by understanding the root causes of disease. We do this by walking together as we learn from each other how to achieve our optimal health. Today, we will continue our journey not by adding more complexity to the conversation, but instead by keeping things simple. Tim Duncan was nicknamed the Big Fundamental. He understood the basics of his sport, which was basketball. He mastered the footwork needed to perfect the post move. As a result, he's arguably one of the best basketball players to ever play his particular position. In order for you to get your new nickname, you will simply need to master the fundamentals of a low-carb diet. Yes, by simply mastering a low-carb diet and the basic principles that are associated with it and repeating them over and over again, you will have all you need to achieve your health-related goals. Just think about it. In the podcast episode number 16, Dr. David Unwin in the UK shared with us the sugar equivalence graphs. Now, he helped us see that the amount of teaspoons of sugar in our food were easy to understand by comparing it to simply looking at teaspoons of sugar. Dr. David Unwin simplified the glycemic index concept by doing this, and we really appreciate him for that. So, if you think about it, making things simple is really how people can make change. And, I'll make sure to share Dr. Unwin's sugar equivalence graphs, which I think everybody should use, particularly in a clinical setting, because a lot of my patients actually have benefited from looking at them. So, but Dr. David Unwin is one of my heroes. And today we have another well-respected low-carb doctor who's also one of my heroes, and that's Dr. Eric Westman. He fully understands how overwhelming the overload of information about low-carb and keto has become. And like the other book he co-authored with Jimmy Moore, Keto Clarity, he and Amy Berger want to provide some clarity and remove all the confusion related to carb restriction. I definitely want to do a shout out to Jimmy Moore for including me in the follow-up book, which was the Keto Clarity Cookbook. And I was one of those keto experts along with Dr. Will Cole, Dr. Gus Vickery, Dr. Ken Berry, Dr. Ryan Lowry, and of course, today's guest, Dr. Eric Westman. A great book with some keto-friendly recipes, so check that out. So why should you listen to what Dr. Westman has to say? Well, for starters, he has inspired many physicians like myself to use diet as medicine and has been doing this for over 20 years as an internal medicine and obesity medicine specialist. His keto medicine clinic at Duke University helped his patients lose over 26,000 pounds and reverse conditions like type 2 diabetes, polycystic ovarian syndrome, high blood pressure, and many, many more. In the book he wrote with Amy Berger entitled In Your Carb Confusion, he shares his time-tested and science-based approach that will help you and anybody who needs that information do well. During this episode, I want us to get to know Dr. Eric Westman and what we can expect in his new book. And Dr. Westman, I want to welcome you to the Protecting Your Nest podcast. How are you doing today?
Well, I'm doing great. Thank you so much for having me on the show. It's a great pleasure.
Yeah, well, it's definitely nice to finally have a direct conversation. Of course, we follow each other on Twitter, and it's been fun to hear your thoughts on various topics related to low carb, keto, etc. So it's been exciting, and actually one of the thrills of doing a podcast is that you meet some of your heroes. So I really think it's been a great gift for me. So I'm curious. I always am curious when people in our profession shift away from mainstream and start doing things a little differently. So when you shifted from the traditional practice, following guidelines, and decided to do things like carb restriction, I'm curious what started that journey for you.
Sure. Well, we have to go back in time, and about 22 years ago now, it was 1998. And if you can imagine, I'm a doctor in a Veterans Affairs Medical Center ambulatory care practice. So I'm an internal medicine doctor treating veterans, so mostly men. And two of my patients lost all this weight. I mean, they lost over 50 pounds since I saw them 60 or 6 months before, and it was unusual because I would send many of my patients to the dietitians and they wouldn't have much success. So in the context of something that doesn't work very well, when you see something work, it gets your attention. So I was an internal medicine doctor in training for clinical trials, and I did 10 years of research with the inventor of the nicotine patch, who's at Duke. So I'm a smoking cessation expert for 10 years. And then through the clinical work I was doing, I got wind of this kind of diet approach that I really honestly had never heard of. And so, people say, oh, you were so brave. And no, I was pretty naive. I didn't know much about diet. Like most doctors, we don't get trained, so, but I saw these people have great success. And then I asked one of my patients who lost all this weight, what did you do? And he kind of looked at me and said, all I did was eat steak and eggs. And I was like, what?
Wow.
Probably was reeling back in my chair at the time. And I said, I don't believe you. And he said, yeah, it's all in this book. And I said, what book? And he says, well, it's the Dr. Atkins book. And I said, oh, no, I heard the name, didn't know much about it. And so it was really the second gentleman who came through, the second patient who, you see, lightning can strike once, right? But when lightning strikes twice in the same spot, I it took my attention. And so I'm the second patient. Oh, no, he lost 50 pounds. Oh, don't tell me. The Atkins diet. He said, yes, that's right. And I said, well, see, I had gone out and read the book then, and I realized that the cholesterol would go up. It's everyone assumes that. You just know, oh, you're going to eat all that fat, the cholesterol will go up. So I said, well, you don't do that because your cholesterol will go up. And he said, well, really? Why don't you check it? And so I kind of remember, well, sure, the lab's down the hall. I'm at the VA hospital where, no one has to pay for these things. And so I said, okay, I'll check the cholesterol, and it got better. So, once and then twice, and, you start seeing things that can't be true, right? You can't lose weight by not counting calories, and you can't lower cholesterol by eating more fat, and all these things were happening. So, I did what everyone would do, right? I wrote Dr. Atkins a letter. Well, because I went to the bookstore, and there were all these books on the shelf, and you can't tell who's a doctor and who's not. And the one that kind of really stood out was the Dr. Atkins diet book, because he was in a clinic in New York City. Most of these other diet authors, you couldn't go visit them. They weren't MDs, and many were PhDs. And so I thought, well, I'll write him a letter, right? So time passes, and he calls back. And I remember the research team I had, a small group doing smoking cessation trials, kind of called me and said, the Dr. Atkins is on the line. And I was like, what? So he actually called back. And we had this discussion on the phone, if you can imagine, sort of like this discussion. He says, well, what do you want? I said, well, a couple of my patients had really good success on your diet. And he said, yeah. And well, so where's the science behind it? And he said, well, it's all in my book. And I said, well, I read your book, and it's all anecdotes. And it is. And when you look at it, it's stories of people having phenomenal success and totally unbelievable kind of stories. And finally, I said, that doesn't count. You need randomized controlled trials. By this time, when Dr. Atkins was in practice, and they really didn't have the metric of randomized controlled trials as something you had to have done, but by the time I was in, professor, we expected randomized controlled trials before we said anything was useful or good. And so I said, well, you don't have any studies, no randomized controlled trials. And he said, why would I want to do a study? I know what the results will be. I've done it 30 years. So I was like, well, either this guy really is just full of himself and a liar and all that, or maybe maybe he's got something there, and it has some truth to it. So he broke the ice. It was his idea, which I do even today. He invited me to his clinic in New York City. And so I invite people to my clinic at Duke University, people meaning, doctors and other even healthcare people, if they want to learn about it, because the visit to a clinic, where, it can't work, well, that's immediately gone. You see that it works. And then the idea that no one can sustain it. Well, you see people who've done it for years, so it's kind of, well, anyway, so I visited Dr. Atkins and saw the practice there. They had a 4-story practice in Midtown Manhattan. And this was 1998. And I said, well, this is all very interesting, but I need to go back and do a study. Here's a study protocol. And so we had a meeting, and it turns out Dr. Atkins pulls the checkbook out of his pocket and writes the check for the first study we
Oh,
did on the
really?
Atkins diet.
Oh my God.
Yeah, so
That's awesome.
it kind of took all of us off guard because I didn't predict that would happen, and he probably didn't think I would propose a study. So I go back to Duke and the VA in Durham, Veterans Affairs Hospital in Durham. We do the first study, and it's 6 months, 50 people on the diet. You follow them, you ask them how it goes, you do labs before and after, and that's kind of the minimal evidence that I'll require to before commenting on something. So if someone says, well, what do you think about the cabbage diet or the whatever? I say, well, show me a paper. 50 people or so in 6 months published in a peer-reviewed journal. So you go through all of that. It's a big deal to do a study like that,
It
actually.
is.
And if someone does that and I read the paper, I'll comment on it
That's right.
because we did that and we published that study in 2002.
Mm,
So
wow.
the first study, and little did I know at the time, but it broke a 20-year taboo on studying low-carb diets.
Right.
So it turns out Jeff Volek, the same month,
Hmm.
published a paper, and we published a paper. Ours was in the American Journal of Medicine, and you look back before that, the paper most recent to that was 1980, and it may not seem like a big deal. We're looking back in time and all that, but this is when I was in training, and nobody was studying this. Everyone knew it was bad. A
And
taboo
then,
means there's no science against it. It's a kind of
right.
a
And
moral,
it's
ethical,
still all this
social.
fear. I mean,
Yeah.
even after you did that many years ago, docs, they're oblivious to the research. I mean, so many of them still
Well,
don't know what we're talking about, and
yeah.
they're still needing to learn. So imagine if you hadn't have done it, and things would be even further behind. So
Yeah.
I'm amazed and so happy.
Well, it's yeah. All I did was really protect data.
Hmm.
So someone said recently, "Oh, you must be so brave, and you're such a skeptic." I said, "Well, no, actually not. I started following data,
Right.
doing clinical studies, and getting more and more and more, and it all kept looking better. And then other people are doing studies, and just because other people don't know the data and think it's you're a radical, no, I'm actually really mainstream because I'm just following the data. But
Wow.
the perspective to other people, oh, you go against the cholesterol and the fat and well, yeah, because the science says it's good.
Yeah. Yeah,
So,
you have to do that.
hmm,
I mean, even when I wrote my first book, Fix Your Diet, Fix Your Diabetes, I was a vegetarian. I had sat down to write a vegetarian book about diabetes, and I started looking at the data, and I was like, wait a minute, the Atkins diet is beating the Ornish diet, it's beating the Zone diet, it's beating,
yeah,
and if it's beating it, I can't argue against the data. And I had to shift my paradigm, which was great for my patients because they were happy to shift from vegan, vegetarian to a low carb diet because they struggled to get rid of their meat. So, but you're right. You have to be honest about data.
yeah,
And even as I study nutrition right now, just like Amy Berger did, I'm pushing back whenever they push the grains and the fruits and things at me. I push back because this should be we just have to have an intelligent discussion. Like I don't think that there's no benefit to those things, but for the demographic I'm trying to treat with metabolic disease, it just seems like a no-brainer that carb restriction is a good way to go. So
Yeah,
Um,
yeah. Well, and it's important to acknowledge there are lots of ways to
yeah,
eat and be healthy, and
that's right.
there's some metabolisms that can get away with murder. I mean,
No
especially
doubt.
young people, if you're active and young, I mean, you can just about
They
eat
can
anything
they can
unless
eat
you're
anything.
yeah,
Especially athletes, if you're young and athletic, you can just, kinda
yeah,
get through it, and even sumo wrestlers can get away with a lot while they're training and doing their thing, but man, when they stop training, things tend to change, so that's this is a big, shift, in your practice, and but I am curious what happened at home. So you have a family. I'm curious about your family dynamics and how did this get introduced to your family too, or was it kind of a separate thing for you?
Oh, well, no, I'm the kind of person that if I was going to do a clinical trial on a low carb diet, I was going to follow the low carb
Yeah.
diet.
Yeah.
I'm the leader of the study. I'm getting up in front of people and telling them not to eat, bread. So I tried it myself and thought it was really good because I could eat burgers and steak and all these other great foods. But yeah, so I brought it home, and it did cause some friction. I do have to say, I have to
Oh, I'm
admit,
sure.
looking back, uh, so I have several children in high school or middle school at the time,
Mhm.
and it was fashionable in Chapel Hill, North Carolina, where we lived, for a middle school or high school female to do vegan.
Mm.
It's all the rage, and
Yeah, that was very popular back
it
then,
gets
yeah.
put in, you don't kill things, and well, so yeah, one of my daughters actually went vegetarian as a result, I think, of doing the
Mm.
research. But it's, some years later, she stopped doing the
Mhm.
vegetarian thing, and I have to say my children go in phases on and off, and
Mhm.
they will be beholden to the great taste and allure of carbs, like most people, and
Yeah.
until for most people, until you hit a roadblock or barrier where your health isn't right or you don't feel well, um, you're not going to have a reason to change what you do. Um, it might be the doctor saying you have pre-diabetes, or your blood doesn't look right.
Mhm.
But most of the people come to my office now, and because of the weight or because of the diabetes, and they're finally fed up. But no, it took some time for the family to kind of, yeah,
Yeah.
okay, Dad's going to do his thing, and so I just didn't
Yeah.
eat the burger bun,
That's right.
and so you do have to learn to have a peaceful coexistence if there are carb eaters in the house.
I agree. I I had a similar experience in that I got a little pushback initially, but what I learned from this, and I think I would say this to anybody listening, because what happens is you do carb restriction, low carb, keto, whatever, carnivore, whatever you're doing, and then you feel great, everything that the light, the sun's shining, you feel great, and then you just want to help people and you want your family to be healthy. And so what I've learned is model for people what you think is something that's helpful, maybe introduce things casually, but definitely don't push the envelope too hard. And that's been more receptive, I think. And people will come to you because they'll know that's your thing and you're good at it. So people will still find you. But I think if you push too hard, it can actually create tension. So I'm feeling everything you're saying. So
There
that's
is
awesome.
that initial kind of almost euphoria or
Hmm.
feeling that you've solved something that you didn't know, and actually you're doing everything against what you were taught, and you might feel a little
Hmm.
naughty at first,
That's right.
and so there's a natural tendency to want to and to tell everyone, and that but the you get immediately kind of uh, as people assume there's projection, meaning people assume you're
Hmm.
going to be like a vegetarian person. And, the old joke is, how do you know if someone's vegetarian? Just talk to them for a minute. They'll tell you, you know, so you don't want to, or they say that about Harvard, how do you know they're
That's
from
right.
Harvard? Just stay for a minute. They'll tell you. But
That's
so you
right.
do want to be, yeah, that's a good word of wisdom. You want to be the role model. When people ask, tell them, and not be too harsh, or promoting it too much, because they're going to assume you're just like a vegetarian who is going to try to save the world by
That's
changing what
right,
you eat.
convert everybody. That's right, and, when I was a vegetarian, there was definitely some of that, and as a low carb, doc, I have to be careful not to
Yeah.
fall into that same rabbit hole. So, you're a very busy guy. You remind me of myself, research, and you have a clinical practice and you have a family. Outside of, your traditional work that we are aware of, how do you spend your time away from work?
Oh, yeah. I always grew up with music as a hobby. So I'm a piano player, and I grew up playing classical piano. Chopin, Mozart, Bach, Brahms, and so lately I actually brought that into my clinic. Maybe 5 years into practice, I learned that a lot of weight loss programs celebrate, when you get to 50 pounds or a certain milestone. So I thought, well, how can I play more piano? Oh, I know. So I went out and got this old Spin-It piano from someone selling it out of their home, the basement, and put it in the break room at work. And so I thought, well, let's do if you get 50 pounds weight loss, we'll play a song for you. So now with the internet, you can find the sheet for a song, just about any song, and so I'll see the jaws drop when I say, it's clinic policy, because you've lost 50 pounds, you get a song. And so people choose the song, and we go to the internet. I download the sheet music, the fake book version of it, and go to the piano. And then all the clinic people come in with the nurses, and if there's some unsuspecting residents and students and pharmacists, we pull them in, and even one of the nurses went out and got pom poms, and
Oh
and
my
so
goodness.
so that's how I brought my hobby back into the
Wow.
workplace,
I love
which
it.
it's
And
kind
for
of
all
unique.
my all my patients listening, listen, I'm not gonna try to be like Dr. Westman. Don't have those skills, but I love that, and I think that, when you incorporate those things and you become more of a human being instead of this doctor, character, I think that that really connects with people. I love that, and
Well,
I
there are a lot of
wonder. Yeah,
a lot of strange things we do. I'm sorry to interrupt. Like, we
no, you're
talk
good.
about food. What doctor talks about food?
I know, never. Yeah, they look at me now. People are discovering me because I think we're both a little bit more public than we were. Obviously I'm newer to it, but yeah, people kind of come to me. But the people that don't know me, oh my God, they. I remember I just made a video about reflux disease, and I talked about how melatonin can tighten the lower esophageal sphincter, and I talked about DGL, which is a licorice type substance that can help with healing of the. And I said nothing about a proton pump inhibitor, and they were like, "What are you talking about?" But and so people are always pleasantly surprised, but they love the fact that you're not traditional and that you're giving them alternatives. And so I love the way it feels. I love the way people respond to that, and I think it's a complete shift in how we practice this craft. So it's really a gift, to be honest with you, to discover it. And even if it's an accidental discovery, it's nice to, feel like a healer for a change. I'm sure for you personally, you
Yeah,
feel like a healer now.
I
And
did.
you probably, I don't know, did you felt that way before this?
Well, so in my other practices I've been in at the VA, being an internal medicine ambulatory care doctor, I just pushed medicines like any other doctor. So when we started our research, I took some time to learn about the residential weight loss programs here at Duke, and I spent some time there. So I got immersed into the culture of weight loss and started doing our clinical trials on low carb and keto. And when the money started drying up for doing research, we opened our clinic. We called it the Lifestyle Medicine Clinic for a while, and then now the Keto Medicine Clinic. So I kind of morphed from the research into the clinical and now teaching, so that I've been able to teach this to doctors at the Obesity Medicine Association, which is the largest group of medical weight loss doctors in the world. And then I taught in 8 different countries in the year 2019. And we went around the country in the U.S. To various cities to bring doctors locally. We were actually in Chicago up on the Loyola campus. These are called adapt events, and had some local docs next time we'll have you there. So, I mean, hopefully 2021 will be out
Yeah, I
again.
know, hopefully, and yeah, I would love to. In fact, I did, when I was in my, family practice residency, I did a maternal child health, fellowship right after where, family docs would learn to do C-sections, tubals, and things like that for rural communities, and although I never really went to a rural community, I stayed at that hospital for a while doing that. I really, spent about, several rotations at Loyola, and, we kinda work with the, neonatologist, the perinatologist, and just spend some time doing some high risk OB exposure for family docs. So it was so I'm very familiar with Loyola and the work they're doing over there. So that's kind of
Excellent.
cool. Would
Well,
love to participate.
you mentioned, being a healer. I was one of the doctors who went into becoming a doctor because I really did want to help people and see them get
Mhm.
better. And so then, as an internal medicine doctor, you really just don't feel that way. The
Mm-mm.
traditional techniques, you just give more pills and products and
That's right.
insulin shots and all that. And people they don't really feel better. You're not healing
Mm-mm.
much. In fact, the term you hear with advertisements is manage your
That's
diabetes. It's
right.
like,
That's
no,
right.
we don't manage it. We want to fix it. And so
That's right.
when I had the great fortune to be able to do the research on low carb initially, and then open the practice and create a model clinic using that, it was like I was creating my own job based on the research that we had done. And it's a wonderful thing. And now it thrills me. And as my friend from South Africa would say, it gives me chills to realize that now there are doctors coming in who don't have to worry about that. Don't have to
Right.
worry about, the 20 years of research it's done. I mean, just come
Yep.
on in and use it. Although
Let's
there's
do
still a
it.
little flack from other people. The patients love it. They get better. They feel better so quickly. And yeah, now I am a healer, which is what I always wanted to be. And just weren't given those tools. And today we aren't given those tools to other new doctors. We teach them how to give medicines.
Yeah, and we're gonna get there. I think we have to evangelize and do our thing, and I think it's gonna work. I just think it's gonna take time, and I really appreciate that, and I'm excited also that you and Amy Berger are doing your part to help those who are, either new to low carb and need to understand it in a simpler fashion or are more experienced with it and maybe need to learn the language of how to share that message with their friends, family, or if they're a clinician, their patients. I felt like a groupie, to be honest. I already told you you were one of my heroes, and I'm not just making it up. You've been doing this for a while. You're a pioneer in this space. But so I felt like a groupie. I watched you guys when you did your YouTube live and you unboxed the book, and I think you used your little cutter thing. You may have ripped a few. I was laughing at that, but it was exciting. And so my question is, when it comes to In Your Carb Confusion, who is that book written for? Like, what was the target audience for that?
Well, it may sound trite or like everyone would say, it's for everyone. So we really wanted to share the knowledge from the trenches of treating people with keto and low carb and moderate low carb and even just low carb. The idea is that the old demonization and worry about fat in the food is fading away. And so this is one of the new rounds of books that I see that we don't really ever talk about fat being bad. We don't even make a defensive posture about, oh, and it's going to be okay. We just,
Mhm.
look, here's food. It's just food. Here's how it works. And we explain how someone who may not really need to change the carbs much might thrive with 150 grams of carbs a day. So
Yep.
this is based on the experience of, my brother, who was, he's the one who grew up active, played basketball in college and all this. Well, he
Yep.
never really had to watch his carbs.
That's right.
Meanwhile, I'm the one who stored every extra calorie into my belly,
That's
and
right.
and I didn't have that natural tendency to want to go out and run and jog, and so even in the same family, there can be differences in your carb tolerance or insulin resistance or ability to eat the carbs. And so we wanted to explain that to the general population. And yes, it's okay, or we'll recommend keto if you need it for diabetes, PCOS, other metabolic issues. And we get into that just a little bit. So it's not a real deep dive into the medicine and the lab test and all that. It's really sort of a pick it up, read, and you'll figure out where you fit. Can you eat on lots of carbs? Do you have to go to the keto level? Can you be somewhere in between? So I think when you look at the whole American population, let alone worldwide, there are a lot of people who do fine eating carbs. And so this explains why that is. And it's kind of like we've been in the trenches of using, it's like we've gone to the war and learned how to do surgery. Now we're back sharing what we know to folks who may not need that level, but we'll explain and show you that it's safe and tasty, and it doesn't have to be hard. And that's kind of the reason Amy and I made it such a good fit, is that her tagline is keto without the crazy.
That's right. I've heard her say that many times. Why? Who came up with the idea for the partnership? How did that kind of morph into reality?
Yeah, well, it was, I asked her to be involved with the book, and I was in need of a professional writer to really expand some ideas. And so with the permission of other folks involved, Adapt Your Life is the company I'm involved in. That's an education company and a product company, but they're also involved with the book. So we approached Amy and said, "Hey, can you help us write it?" And she's a great writer. It's it's funny at times. It's sarcastic. It's and or then straight down gets to the point.
Yeah,
So
that's Amy, though. I mean, if you watch her YouTube channel, she's pretty much the personality you've just described.
Yeah. So she grew up in Staten Island, or outside New York City, and so she's just very direct.
Yeah.
So I think I'm really pleased with how it came out. It's actually kind of a nice looking book, The Victory Bell publisher did a great job in making it pleasing to the eye with purple, and I hope my intent was to have even simpler book where you could just read it on the plane for an hour and you'd be done with it. And we expanded it a little more than that, but it's if you're looking for something like the latest on fasting and mTOR and all that, no, that's not what it is.
That's not it, right?
Not at all. Yeah.
That's cool. We'll have that at one of the conferences. So, and I do appreciate that you wanted to keep it simple, but I also know that when you get something in front of you that's a great tool, you want a little bit more. So I think people would have been really thirsty for more. So, and I guess having said that, when I listened to you guys talk about it, you mentioned there were some additional tools that would be connected to the book. Could you talk a little bit about that?
Sure. Yeah. So we were rolling out one of the first digital classes that we were making. It's from adaptyourlifeacademy.com. And the first class is Keto Made Simple. It's me giving 12 different short video lectures with slides, and you get to be part of a group that starts out if you need to start out, or reboots if you need to reboot. So that's called the Adapt Your Life Academy, adaptyourlifeacademy.com. And we're just rolling out the first class, and we'll have others. In fact, Amy's working on the Stall Slayer class. She has a book called The Stall Slayer, and that'll be part of the Academy. And then we're going to be working on the different levels that come from the End Your Carb Confusion book and turning those into digital classes, so that, some people like to read, some people like to watch video, some people like to listen to podcasts. So we're going to try to have that in every different form, so that you can truly understand the fundamentals. I loved your intro about learning the footwork to play basketball. It's like, well, what do I need to know that for? It's Roddy Kid type of thing.
Kobe Bryant will tell us why, because that's why he's one of the greatest ever as well. You got to have the footwork, right?
Yeah. Well, so this is like, you got to know the fundamentals of low carb, and it's not keto shakes and products, and it's keeping the carbs low. And this has been around actually for 150 years, the low carb keto diet, and it was used for diabetes 100 years ago, and then it was just forgotten. And I think all of the new products and things have drawn more attention to it. You can check your ketone levels and all that, but we don't talk about any of that in the book
Yeah.
or the class. We give you the old style keto and low carb, where you don't have to worry about that, because the way I teach it is so robust. It works so well. You really don't have to monitor those things.
Yep, and I know just for those who are listening, we're going to have a little bit of a YouTube live where we're going to walk through some of the approaches that Dr. Westman has in the clinic. So I'll make sure to have a link to that in the show notes, and I definitely appreciate you doing that. Another thing that Amy mentioned during the book unraveling YouTube live you guys did, she talked about a checklist, and so it kind of helps readers to determine how they should start. So tell me a little bit about that.
Yeah. So to determine what carb level you should start at, and it's there's no test you can do to say, okay, you need A, B, C, right? Or 50 or 100 grams. But there are certain conditions and certain scenarios, like if you're heavy over a certain weight, or your diabetes is you're on insulin, something like that. We point you to the carb level by taking a simple, checkbox sort of. It's not really a quiz. It's more like, where do you fit in? And then at the bottom of the table, you get sorted into one of 3 different carb levels where we pretty much think you'll be. And so you start out there, and if it's not the level where you need, because you're not seeing results, then we show you how you can change to the other levels, by yourself. So it's, so many people today are starting keto on their own, partially because there's a 6-month waiting list to see me at Duke. So someone came in this week and said, I started this 24 weeks ago, and I've lost 50 pounds already before seeing you. And I was like, oh, well, you don't need me. So actually, if you don't have medical problems and you're not on medicines,
That's funny.
this works so well. And so we'll direct you to the level that we think is most appropriate. And so, which, again, trying to make it easy as possible, and knowing that a lot of people don't really want to know all the details of how it works. It's kind of like when I take the car into the shop now. I don't really want to know what rubber gasket went out, and just fix it for me, okay? I mean, there was a time when I did, and I thought and then cars all changed. But we're trying not to. We're resisting the temptation we have to teach you all the deep dive details, because just fix me is really what people tell me in the clinic.
As I listen to you, I've had the same experience with patients. They'll learn about me, and I have, on my website at drtonyhampton.com, I got a why and how do a low carb diet, right? So some of the people, it takes them a month or 2 or whatever to get to see me. By the time they see me, they've already started losing weight. They look at the videos, they start following the
Yeah.
principles. You could almost write a book. And I'm not, trying to be funny. You can write a book and say, okay, low carb, less than 50 carbs, keto, less than 20 carbs, do that and you'll be done. I mean, there's other issues that, factor in, but to be honest with you,
Well,
is
that was
really
the
that
book I
simple.
wanted to write, and the publisher said it wasn't long enough.
Right? Yeah, they're thinking they're marketing people, and maybe in the long run it'll be better for you. But I'm telling you, I'm like you, man. I'm like, just keep it simple. People just need to know the basic information, and then for those who struggle, we'll find some other things for them. But I am
Yeah.
on the same page. Do you use the term? On my website I have metabolic health. So do you use that language in your book at all? Talking about metabolic health at all?
Yeah. Yeah. And metabolic syndrome and other. Yeah, we do.
Okay.
I like
I
that term.
figured you did, but I just was curious because I think people, for those who like the fact that you went from the previous name to keto clinic, that's a big paradigm shift because it's scary to people, particularly health systems, particularly like Duke. I think they know who you are now, but a lot of docs would be afraid to do that. And but I think the metabolic health is more of a neutral term that can allow you to do other types of diets as well and achieve the same goal in the appropriate person. And we know most people need to be on carb restriction to achieve their goal, but it's nice to have a kind of a more neutral language for people so they can feel comfortable while not being afraid to say keto. I'm definitely not afraid to use that term and to put it in front of people. I am curious about the clinicians. They're not trained at all in so many ways to get this information. What's your thoughts on broadly, how do we get more docs trained about this carb restricted lifestyle? Even your book will probably be helpful, but what's your thoughts on how we can kind of grow our community?
Yeah, well, that's a great, great question, and I've seen things change slowly over 20 years. Oh gosh, health systems will wait until there's a big study that shows something, which makes sense. And now with the Virta Health study, where they gave people ketone monitors, and there was this weight loss, and 20% of the people got cured of their diabetes. I think that's going to be a game changer in terms of the solid science that's needed to change organizations. So as we went around the country with these ADAPT events, there was a range of institutional acceptance, or even not allowing doctors to use a keto low carb diet. This was 2019,
Wow.
so just last year. And although there are pockets of doctors who learn and then spread the news, Gary Taubes has a new book coming out this fall, or maybe first quarter 2021, where he interviewed lots of doctors who use keto diets. Gary, of course, wrote the pioneering book, Good Calories, Bad Calories, which was very helpful for me to understand the weak science of the low fat movement. We were all taught by something that really didn't have a lot of science behind it. But, so what I observe is that people come to meetings like the Obesity Medicine Association. I'm a past president of that organization. So I think I've taught a lot of people through there. And I feel like I'm just passing along a baton. Again, my story is I learned from Dr. Atkins, who sadly died in 2003, and then learned from his nurse that has been a friend since then, Jackie Eberstein. I've known her now for this last 20 years. And I think having the more scientific studies is important. Once the health system goes for a results-based sort of treatment, doctors are going to have to go toward this.
Right.
So if you come in and the A1, but here's the easy answer for the doctor is give the insulin to get the A1C down.
Right.
I don't have to wraggle and worry about the food. I just give more insulin. Of course, then the insulin causes more weight gain, which is the cause of the diabetes in the first place.
That's
and
right.
The docters say, well, you're going to have diabetes forever. Well, because you're giving them the insulin that causes diabetes forever. So it's almost like all these things have changed so slowly, doctors don't realize that they're just perpetuating the problem.
And I remember when I wrote my book, right, a few years ago, and I was thinking about when I saw the advance in a cohort study, and because I had learned a lot from the low carb community, it was so glaringly obvious when the microvascular disease, which is the eyes, the kidney, and the feet, was fine, but then the macrovascular disease, the heart and stroke, was not doing so well with all of this insulin being pumped in your body. And they doctors kept saying, we don't know why. And I'm like, I know why. And I'm not like the smartest guy in the room. It's because of the insulin. So and sometimes I feel like I'm in a matrix. I've said this before, like why can't they see what I see? And we really have to do better as it relates to maybe they're just not asking the why question enough. You have to keep asking why until you get a really good explanation instead of saying we don't know. And it just breaks my heart. So
I'm excited. I'm reassured the young doctors today that I've seen, and or maybe they select themselves out by coming to my clinic.
Right, that's true.
But the ones who are asking why, or isn't there another way to do it? I'm encouraged if
That's right.
once you get out of training, and a lot of most doctors become jaded, and
Mhm.
you're just punching the clock, and 15 minutes or 10 minutes with patients, you just do the quickest thing. And so a lot of doctors will set up their own type of practice to take the time to teach and to de-prescribe it. So it takes a lot of effort, as you know, to take
Yeah,
someone off of insulin.
that's right.
But then they're not on insulin and they don't have diabetes.
I know, it
So
just
it's
changes.
worth
It's
the
worth
extra
it.
effort.
It's the best return on investment ever. In fact, I was wondering as I asked the previous question, this idea about, your doctor's listen up video. When I'm talking to people who are, they see other docs and they're nervous about this, I say, check out Dr. Westman's doctor's listen up video. So I'm assuming that was also inspired by your desire to get more docs to get that message.
Yeah, well, that came out of I'm doing a retreat, um, Dr. Westman Keto retreat. We did one earlier in 2020, January, right before things shut down. And we're going to do it again in 2021. We'll be socially distanced. And it was out of that. I spent the weekend with, I think there were about 50 people who came from all over. And we had lectures and talked in the evening. And one of them, it just, a recurring theme is you need to do something to teach our doctors, because our doctors are pushing back, and even like you said, everything's getting better, and but then they'll say you can't do this, or they'll say, and it's not sustainable without any science or
Right. To justify
backing up
it.
of it.
Right.
So as a result of that, I learned a lot of things that weekend. But I thought, the first thing I'm going to do is come back and do a doctor video. So me, pretending I'm talking to other doctors, like at a meeting, and I'm not a whole lot of people have viewed that video, sadly, at the website. But I'm glad you noticed it.
Yeah, I love it. You need things, right? Anything, whether it's the diet doctor, metabolic multiplier, anywhere I can refer people to get some
Yeah,
information, Verta Health, of course. You just got to do it. So because in my world, just so you know, Advocate Aurora, which is in Illinois and Wisconsin in the States, we're since we've merged and things slowed down because of COVID, but we're establishing a weight management program. I'm fortunate to be one of the team members, and we do have about 5 or 6 board certified obesity medicine docs like myself. So I've gotten that training that you've helped to lead and get training under. So I guess I do have a question about that. So if you were me, I'm kind of like you were to Dr. Atkins, and so I'm looking for guidance here. So when you
yeah.
think about if you were me and you were in a health system, a large one, just like Duke, and you were getting ready to start a weight management program. And I do frame things with them from a metabolic health perspective with the hope that they'll lean in a more carb restricted. At least I just want that to be one of the major options. What
Right.
any advice you would give to me or my health system to ensure everything goes well? What's your thoughts on that?
Yeah, well, there are a lot of ways to go about doing something like this, and our situation at Duke is pretty siloed financially. So, for example, the surgical group is different than the medical group, which is different than the residential group, which is different from the pediatric group. And at a Duke, where it's a very heavily research-based organization, it's going to be either the education or the RO1, the research funding that will get groups together, so that while we're not co-located together, we offer, and I think any program should offer, a dietary approach, and hopefully 2 or 3 different types, including keto. And so you have different options. I just heard a talk from the group at Cleveland Clinic. They're using a keto diet, a Mediterranean diet, and then a plant-based. So they've covered all of the politically correct ways to go about things. If people ask for it, you can teach it, and then if it doesn't work so well, you push them over to the ones that work. if they can't succeed with those. So maybe 3 different dietary options. Having one doctor who's up on all of the medications, maybe, or if all the doctors are using medicine, some doctors do it that way. I prefer to have a medication option separate than the dietary option, because using keto, you don't need medicine. And then there will be people who are on so many medicines already. You want to have a nutritional approach where you're not adding new medicines. So that's where I've been able to treat people who are so sick with heart failure. They have LVADs implanted in, for their heart pumping. They're so seriously sick, and the doctors have no qualm sending me the patients who are too heavy to have a heart transplant, because all I do is change the food. I'm not adding a new weight loss drug or sending them for surgery, things like that. So you want to have a nutrition, a medication, and then I think it's important to have a VLCD. So that's a very low calorie diet program. The trade names are OptiFast, MetaFast, Robard. They will train you how to use it. Now, it's not cheap, so you're going to start getting people have to start paying for it. So that's a barrier. Although some programs will help defer the cost, or the health system might understand that if I can fix this person's diabetes with a VLCD, it's worth the cost.
Right.
So it's some sort of pilot program looking at costs like that. Like Dr. Unwin had amassed the information in his practice in the UK. You can actually save money over time. And then, of course, the surgical programs probably exist already. But if you don't have one, or as a referral, maybe for a system, you would refer to a surgical program. Because there are, if someone's BMI is 60, they weigh 450, 500 pounds. I mean, it's tough for the lifestyle alone to fix help these folks. I mean, we can help people lose weight before surgery, but there is a role for surgery in a comprehensive program like this. Now, some programs are co-located in one place. So if you started, you had all the resources in the world, you'd find a new space and put all these things there, or maybe even locate next to the referrals I get are the orthopedic surgeons. They find that their patients do better when they're not so heavy, when they have a knee replacement, hip replacement. So I get a lot of referrals from other surgeons. So, and then of course the heart failure and heart surgeons send me their patients. Those are just
that makes a lot of sense. I like that collaboration. Like, I need you to lose this. I just had this happen today. A patient said, Doc, they said I have to lose 60 pounds, before I get my transplant in 6 months, right? So, and that's why they sent them to me. But I like this idea of a partner and saying, hey guys, we have a lot of things to fix. We got a lot of issues to work together on. Let's create programs so that we can support our patients through, because what happens is some of them just don't get to the goal, and then they feel like a failure. And we're talking about surgery to have a transplant. We can't not get that right. We have to put them in a position to get that, because when you go from dialysis to new kidneys, your life transforms. Like, it's like a complete different life. So that's very helpful.
No, I traveled twice to a hospital outside of Hong Kong, in Shenzhen, China. And the hospital director did low carb himself, fixed his diabetes. And so he was able to say, we're going to do it for the whole health system. So they asked me to come give some talks, and I did rounds with the folks. And so if you have a kind of an enlightened hospital director or medical system, or I'm not sure at what level, but who has the ability to just say, we're going to be training all of our doctors. So there was a meeting with 1,000 doctors from the area. I mean, you have to understand there's a lot of people in that area. And then when they say you show up, they all show up. But that's another idea, is that you train in lifestyle and maybe medication for weight, but lifestyle is so potent. It works so well if you reduce the sugars and starches rather than the fats and calories. But so that's another idea, is you just from on high, you proclaim, we're going to train everyone, and you all come to a meeting.
That's right.
So, one of the benefits, I guess, of having a Chinese system is that you have that top-down control.
Right, exactly. I know. Yeah, that's interesting dynamic. We're supposed to be, physician slash clinician led. So, but at the end of the day, a lot of these large health systems, there has to be a little control at the top. But I like the maybe a little bottom up.
Yeah,
Sometimes it
well,
takes the bottom up to make this type of stuff help happen. So,
yeah,
but I agree. I think about the ADA president or CEO Tracy Brown and how she
yeah,
was able to get off of insulin with a low carb diet. So,
yeah,
truth be told, I'm not sure what's happening behind the scenes, but that matters when somebody at the top knows this stuff works and
yes.
they're able to, at least message at some point that that's a beneficial. What about groups? Like I know you do groups, you do classes. So if you're doing a weight management program, how vital is the concept of having groups to maintain people's levels of success?
Well, like any behavior change, it depends on the person. If you train someone, teach someone how to ride a bike. Some people get on and they ride, and they don't. You don't need to hold the put training wheels on and all that. So people who end up coming to a clinic for care and treatment in this way, they haven't figured it out on their own. Most of them need some sort of support, at least as they get started. And in the medical weight loss world, we kind of say, don't let people go more than once a month without checking in. And now this fall, there were some interesting presentations at the obesity medicine virtual meeting where many of these programs went all virtual because of COVID, and the success actually was really good comparatively. So it kind of depends on the clientele that you have. Do they tend to follow the rules and figure things out really well, or do they need more hand holding and get tripped up over, I didn't realize that sweet tea had sugar in it, which has happened to me. Someone came in not remembering that sweet tea had sugar in it. So, so it kind of depends. At most, billing wise is an issue. If you're going to be in the insurance pay kind of system, you
Hmm.
can do billing for that. It's one way to increase the number of people you see, but I think some people do well with just one-on-one a few times, and you just teach them the direction, depending on what kind of program you use. Something like keto, that's very simple. If you teach it simply, and some people just get it, and then you really don't need to see them. Or as I mentioned, some people get it before they even seen me.
Right, right. And then you have those people like we had Joan Iflin on, in the
Yeah,
past, and she
yeah,
actually
I know
joined us
Joe.
for yeah, she's awesome. She
Yeah,
actually, Danny Davis, who I'm sure won his reelection, one of the Congress people, for, Illinois, representative of Illinois. He has a nice show on Monday evenings on Facebook Live on one of the it's called Couch Potato with the Docs, but she came aboard, and it just seems like most programs, there's got to be a group of people who are you're treating that's going to have issues with food addiction, and they're going to need additional resources as well. So it's almost like you have to put people in all these different buckets and
yeah.
make sure that the needs are being met in a way that allows for everybody to, get what they need. So I think that's really
Yeah.
pretty critical. So I'm
Well,
very excited.
I had a vision, or I saw a vision of the future. This was the talk given by the CEO at Verta Health.
Hmm.
He talked at the first conference on deprescribing, which was held by Sean McKelvey in Vancouver, Canada. He's a pharmacist, and so he's promoting getting people off the diabetes medicine using a low carb, and pharmacists can actually help be on the team to do that. But the CEO showed a picture of what kind of like command center or central. They had like 5 or 6 computer screens, all like this, and the study participants had the ketone monitor for their blood and the Bluetooth scale. And so imagine, and some clinics are doing this, but it wouldn't take much. Where actually you're monitoring thousands of people daily, and if they're not losing weight, or blood sugar getting better, or you contact them, so the
Wow.
digital sort of control. I mean, it was, almost sci-fi, where people are, with permission, you're getting monitored, and then they contact you if something's up. And I know some of the docs are actually like giving out their cell phones and saying, and calling, like, I noticed your blood sugar went up. What happened? Now,
Right, right.
I'm not, I'm not that intrusive as a doctor, but I know a lot of people are kind of like that level of control with smart watches and things like that. But so that's kind of the health system of the future. Is, we're all walking around with health monitoring devices, and when something's wrong, your posture, fix your posture, or your blood sugar went up now, or maybe that's just too eerie. I don't know, but within the context of that
It's
study,
technology. I mean, we're going to be doing some of these meetings. These group meetings are going to be Zoom. I know, you
yeah,
know, Joan Iflin. I mean, she has her Reset community. They just have a lot of meetings virtually, and you can
yeah,
reach a lot of people and probably keep the cost down. Which is, as you have suggested, you got to keep the cost down. And we have a population health model, so there is a little more wiggle room with the patients who are under that type of population health, because we do better if we manage the population. So I think the nature of our health system may give us a little bit of an edge and incentivize us to do this. So I think there's a lot of hope, and thankfully yourself, Dr. Unwin, Verta Health, and others have given us some data to work with. So as we encourage this, it'll get us on the path to do well. It's almost
yeah.
like I feel like you're living your purpose. I kind of asked Dr. Unwin that question as well, and I guess as we get towards the end here, uh, you know, I'm curious about, do you have a true north goal that you're trying to achieve? I mean, do you feel you're living your true north now, or is there some things down the road you want to do?
Well, I'm one of those overachievers whose job will never be done.
Right.
Yeah, I can't imagine ever retiring. I feel like I'm just getting started at the age of 60. So
I love it.
I think we're at a new phase of teaching, and with the virtual platforms, I'll personally be able to help. But it's gratifying to teach other doctors what, how to do things, and then they're going to improve upon things. And so, but as a kind of exit of maximizing what I do, training other doctors will increase the number of people who get available information and care. But also, there's that classic story of, you can work hard as a doctor and pull people out of the stream, right? You're in the emergency room, you're patching up holes and all this, and you're pulling. It's like pulling people out of the river. It's hard work, and at the end of the day, you save the life and all that. But it's the public health kind of uses this as a metaphor, but also it's the smarter doctor who goes upstream and stops people from jumping in the river.
Right.
So you don't have to pull them out of the river and make it all. So I think a really awesome state-of-the-art system would get that and say, well, let's get people before they have diabetes.
Right.
Let's get children before they have obesity and diabetes. And, so the preventive, that's what's going to have to happen, because it's not happening now. The statistics on our youth is not good.
It's getting worse. Yeah. Even when I was in my obesity boards training, it was not looking good. I don't think it's improved. But again, only hope I have is that there's less fear about this way of thinking. So I think we just have to kind of have more people sharing that message. So that's good stuff. This has really been helpful, because it's helped me to, again, I cheat a little bit, and I hope my audience gets value, because I'm trying to think, how do I do my role as a doc who's trying to change the world as well? And I'll just consider myself a student, as you say, just forever. But I am curious, as we always wrap up with the simple question, and that nest and rope. And the nest, I always remind people what that means. So the nest is nutrition, exercise, less stress, more sleep, how we think in a positive way, hopefully, and avoiding trauma. And the rope is making sure our relationships are good. The avoiding organisms, we know what that is nowadays with COVID, pollution, rather it's something you have in the air or in your mouth that you put in your mouth, and the E for protecting our emotions and our life experiences. So when you think about that acronym Nest Rope, when you think about your personal journey, is there any area that you're personally trying to strive to improve?
Yeah, well, without getting into too much detail, I spent the first 50 years in my head, and now I'm trying to learn how to be in my body,
Wow.
which is I think that's my next 50-year project.
Right. That's deep. That's a deep. You just gave a very high level philosophical answer. I like that. That's
We could talk
awesome.
for hours on another time about that, but I
That'll
think
work.
everyone has their own um, journey, and yeah, to be whole, you have to address the different parts, including the spiritual side. I thankfully have been blessed to have grown up in a pretty faith-based kind of childhood, and so that my getting all these things in line, right? Isn't that kind of the ultimate goal?
Yeah, and I love that. I mean, we gotta understand why we're here and what we're trying to achieve, and I think that having that purpose is incredible. So I do appreciate where you're going with that. So
Well,
that's
thank you so much for your work. I'm as a teacher, we are most pleased when students go way beyond where we were.
yeah, and I love I love it, and again I feel like a healer, and that's why I appreciate the foundation you and others have laid. So I guess the last thing you can do is remind us. You mentioned a few things like the academy, the classes. How talk a little bit more about how to get the book. What formats is it in? What formats is it gonna be in? Release date. Tell us more about the book.
Sure. Yeah. So the one stop shop website to go to is the drwestmanonline.com. So drwestmanonline.com. And it will have links to various things. I mean, you can download our sheet called page 4, which is the list of foods. There's a
Famous
small fee.
page. I've heard of that. I've heard of that.
This is like almost a freemium because it's $9.99. Everything that goes to research and education for keto. So uh,
Cool.
then there's a free video to watch with that if you want, and then the Adapt Your Life Academy. .com, or there's a link at the drwestmanonline.com website, will take you to the Keto Made Simple Masterclass, which is rolling out in November 2020. Now, the End Your Carb Confusion book, which I'm excited because it's not just keto, it's figuring out what your carb level is. It's coming out in December 15, 2020. And it's available for pre-order at every major bookseller, and that it's in a paperback form right now. That we're planning other forms, but that's it for now.
Cool. Well, that's excellent. Thank you again for that resource. Thank you for, spending time with me getting to know you, you getting to know me, and I'm really excited. And again, for those who are listening, we'll have a little bit more time to spend on YouTube just to kind of review some of the things that you do in clinic for that audience as well. So I'll make sure that happens. So thanks again, and really, I really, really appreciate the time we spent together today. So, and for those listening, protecting your nest is much easier when you have some tools to help you on your journey. So hopefully that wonderful book that my guest and Amy Berger wrote together will provide some help to end the confusion you may have had about how to introduce a carb restricted lifestyle or a keto lifestyle into your life. And not only your life, the life of your friends, family, and if you're a clinician, the patients that you serve. And I really appreciate Dr. Westman also teaching us, to consider bringing our gifts to work. So although I don't play the piano, I certainly will consider the gifts I do have, and I'll make sure to bring those to work. I think humor may be the gift I have, so I'll try to crack more jokes and get more laughs out of my patients, as I kind of take my journey as well. So I just want to say to everybody listening, I hope that the value that you expect to get out of this podcast, you're getting. I hope that every day you learn just one nugget. If you just walk away with one nugget and you can use that in your life, I think it'll make a huge difference. I know it does with me. And I think as you are learning, I'm learning as well. So I will wrap this up. And as I always say to you, thank you for listening today, and continue to protect your nest. You've been listening to Protecting Your Nest with Dr. Tony Hampton. For more, visit drtonyhampton.com.